Welcome back to For the Record. We want to talk now about antivirals. It's something many of us have questions about when illness strikes us or our families. Our Kristen Powers speaks with infectious disease expert Dr. Amish Adalja to try to answer some of those questions.
Dr. Adalja, obviously people can get vaccinated for COVID and the flu, but even if they're vaccinated, you can still get sick. So we definitely want to talk about the treatments that are available. Who is considered high risk for those more serious illness of COVID-19 or even the flu?
So with COVID-19 and flu, it's almost the same group. It's people at the extremes of age, very old, very young, anybody with any underlying condition. So that could be cardiovascular disease, that could be lung disease, that could be some kind of immunocompromising condition, and especially also pregnant women are also at high risk. So there's a large swath of people that when they get COVID, when they get influenza, they may not just have a mild case. They may have a complicated case, which causes them to be hospitalized.
And if someone finds themselves in that position, who are antiviral treatments most recommended for? Can anyone take them, or is it a specific group?
Antivirals are most effective in those people with high-risk conditions because they prevent the complications, hospitalization. So you sort of have to have that baseline risk to begin with. For influenza, you can get better quicker. If you're a low-risk person and you get flu and you take the antiviral within 48, 72 hours, you might get better a day quicker. That's not a big deal, but if you're high risk and you take the antiviral, it may prevent you from going to the hospital, and that's a major benefit. So it's the high risk people that we really want to make sure that they know that their antiviral is available and that they ask their providers, do I qualify for an antiviral? Because sometimes providers don't remember to prescribe an antiviral. They don't think that the patient wants an antiviral, and these are being underutilized, and that really makes it much harder to work in a hospital when you've got people being hospitalized that maybe wouldn't have been hospitalized if they would have called their primary care doctor, got an antiviral, and their case was not as complicated.
Can you explain how antivirals work?
So an antiviral basically is a molecule that you take by mouth, and what it does is it interferes with sort of the cycle that the virus has to go through. It will block one of the functions of the virus. So there's different antivirals for COVID, different antivirals for flu, but they basically are interfering with the way a virus operates in your cells.
Can you also talk about, you touched upon how you think they're a bit underused. Why is that? I know antivirals are prescription medications, and what is the best way to make sure your treatment plan is the best path for you personally?
They're underutilized because I think there's really been less appreciation amongst providers about how valuable they are, because when drugs like Tamiflu got launched, much of the marketing was about it gets you on your feet a little bit quicker if you take it early enough. And they didn't really emphasize the fact that it prevents complications. And the same thing is true for COVID-19 antivirals. People don't really understand how beneficial they can be. And with COVID-19 antivirals, people are intimidated sometimes because of the drug-drug interactions. And they don't want to mess with other people, the medications of a doctor has prescribed. For example, if they're on blood thinners, things like that, that can be complicated. Those are things that you can work through. The other thing is that many of them have these windows. So we talked about 48 to 72 hours for Tamiflu. For COVID antivirals, it's usually 5 days. Sometimes people aren't quite in that window, or they think they wed themselves very strictly to that window and don't really understand when the window applies and when it doesn't apply. And they may say, oh, it's too late for you to benefit from an antiviral, when they might still benefit from an antiviral.
For people who are diagnosed, what would be your recommendation for a plan of action to make sure they're able to meet those windows and get the correct antiviral treatment?
So if you're high risk right now, you can be tested at home for COVID, for flu. Those tests exist. As soon as you test positive, you should be calling your primary care doctor saying, I tested positive, I've had symptoms for 5 hours, 10 hours, whatever it may be. Do I qualify for an antiviral? Can you call me in an antiviral? They need to be really proactive to make sure that they actually benefit from these antivirals, because the antivirals don't do anybody any good if they sit on shelves and people don't use them.
Why don't you think some physicians are prescribing these? You really are honing in on, we need to be the advocates and we need to say, hey, this might be good for us. Why do you think they're being underutilized here?
Because when antivirals came out for flu, for example, they weren't really thought of as something that's going to be game-changing. They thought of them, this is going to get you on your feet a little quicker, and then people say that's kind of plus minus. They don't really understand the benefit that an antiviral for flu has. And that really came to light during the 2009 H1N1 pandemic, when antivirals really saved people's lives. So there's still a mindset in many providers that these antivirals are just, they're good to have, they're not game-changing. And with COVID antivirals, I think people are intimidated by the drug-drug interactions. They also look at someone with COVID and they say, oh, they look good right now, they're not going to need an antiviral, not realizing that the antiviral is what keeps them looking good. So there's a little bit of a bias with how people treat viral infections in a way that they don't treat, for example, someone with a bacterial infection. Someone comes in with strep throat, they always get an antibiotic. There's no question about that. But with the antivirals, it's a little bit of a harder sell because they just really haven't galvanized the population the way that of physicians the way antibiotics did or the way other treatments have.
With respiratory illness season, how would you say this year compares to the past few? Where are we trending?
I think we're still pretty heavy with many different respiratory viruses, influenza, COVID, RSV. I've been rounding in these Pittsburgh hospitals the last couple of weeks, and I saw a lot of influenza patients, many of them not vaccinated. So influenza is back to sort of its pre-pandemic levels, and it is still something that's a pretty serious illness. We've seen also RSV, and COVID is still around. So all three of those are threats that are hitting hospitals, crowding emergency departments, crowding ICUs right now, even in Pittsburgh.
Do you think people are forgetting about vaccinations, especially for a sickness like COVID, now that we're not in that height of the pandemic?
I think that because COVID is recognized as something that's never going away, people have gotten complacent, especially the high-risk individuals, thinking that they've gotten enough vaccines, they don't necessarily need any more. But we still see people getting hospitalized every day from COVID-19. So yes, I think once people get familiar with an infectious disease, they're less likely to take it seriously.
When talking about respiratory illness season, what would be your recommendations to people? What should they be watching out for? How can they prevent it? And I know we did touch heavily on, being an advocate for yourself if you need an antiviral.
One of the things people need to do is remember that we have tools, vaccines, antivirals, home tests. You've got to use those things. We don't have those for many other infections, but we do for respiratory viruses. If people use those and then realize that in this season, you're going to be inundated with these viruses in every interaction with people. And you can take kind of these simple steps of making sure you're up to date on your vaccines, testing yourself if you get sick, and asking for an antiviral. That's going to minimize the suffering that you have, as well as decrease your contagiousness and spreading of these viruses all around the community. But again, this is sort of part of life, that there's always going to be these respiratory viruses. The good thing is that medicine and science have given us so many tools, but we just have to use them.
Still ahead.
Be very diligent about reading those ingredient labels because the dyes can be kind of hidden in there. So you really have to scan those ingredients to make sure that it's not listed.
Concerns about red dye number 3, what one local doctor says families need to be mindful of. Welcome back. We want to turn now to another major health headline that Pittsburgh families are watching. The FDA putting a ban on red dye number 3. The dye appears in foods, beverages, and medicine, and the concerns, including cancer concerns, have led to questions over the years. Our Elena LaQuatra spoke to the chair of AHN's Pediatric Institute. Here's a preview of the interview you'll see on Pittsburgh's Action News 4 Monday morning.
What I thought was interesting in doing a little bit of research here is that you can find this red dye number 3 in some products you wouldn't expect it. Some of them I thought was interesting: vegetarian meats, bacon bits, sausage. Should parents, really anybody, but I know parents especially are concerned with this red dye number 3. Should they be worried about all these different products you can find this red dye number 3 in?
Well, I think it's one of those things you want to be mindful of it, but you don't have to be crazy about it. So there's going to be a lot of products out there that you're not going to be able to find an alternative, a food that your children might like or you might like, or a medication you may take. Again, remember, this is in just high quantities that it causes cancer. So being exposed to it here and there while the ban starts to roll out, I think is okay. But again, you want to try to be mindful and avoid it when possible.
We want to invite you to tune in to Pittsburgh's Action News 4 Monday morning for much more on the concerns surrounding red dye number 3. And tune in Monday at noon for that full interview. That's all the time we have for today's edition of For the Record. Tune in next Sunday morning at 11:30 for an all-new episode. We'll see you then.